Friend, today I am going to tell you about the causes and treatment of erectile dysfunction, that is impotence. So as you all know, impotence, that is erectile dysfunction, is a very common condition in society. Almost 5 to 10% of young men and 30 to 50% of men between the age of 40 to 50 suffer with this condition. In erectile dysfunction, penis hardness is not achieved sufficient to have successful intercourse, so that boy or man cannot do sex completely. It is one of the common sexual problem among men, resulting in lot of dissatisfaction, low sex confidence and impaired husband-wife relationship. So that you all must know the causes, diagnosis and treatment of this condition. So erectile dysfunction causes are, it can be due to some hormone disorder. There are many sex hormones and other hormones which control sexual response, like testosterone, prolactin hormone, thyroid hormone, then growth hormone, adrenal hormone. There are various hormones which are secreted by testes, pituitary gland and with the help of hypothalamus. So any disorder of testes, pituitary gland, hypothalamus or adrenal gland can lead to various sex hormone disorder, resulting in impotence and sexual inadequacy. The second cause is decreased penis blood flow due to various causes. So there are many conditions in which the artery supplying blood flow to the penis gets blocked due to deposition of cholesterol in them. Like it may occur due to heavy smoking, it may occur due to diabetes, high blood pressure for a long time, high cholesterol and many other systemic diseases lead to deposition of cholesterol in the artery, resulting in less blood flow and impotency. Then third cause is venous leak. In venous leak, blood flow to the penis normal, but in place of staying in the penis and resulting in good tightness, the blood leaks back. So in one way, it's good flow is there in the penis, but other side is leaking back. So venous leak is also one cause of erectile dysfunction, which occur due to various causes. Then comes systemic diseases like kidney problem, liver problem and other systemic diseases like COPD and neurological disorder like epilepsy can result into decreased penis blood flow and impotency. Then psychological disorder like depression, anxiety, psychosis can lead to impotence. Then drugs, medicines. So drugs like beta blocker, some diuretics and some antipsychotic drugs lead to erectile dysfunction, that is impotence, leading to difficulty in having sex. Then lifestyle disorders like too much having busy life, stress in the life, performance, too much pressure of the work, lack of adequate rest leads to impotence but transiently. Then psychological issue like they not having good relationship between husband and wife, having doubt about wife character or some other reason can lead to impotence also. Then there is one condition called Peyronie disease, in which the penis has some bleeding the penis, resulting into angulation. Penis become that angulated, that bent occur in penis along with pain. When your penis get erect, there is bent with pain. They call Peyronie disease. So this is also one cause of erectile dysfunction. Then comes with old age, lot of low sex confidence comes. That people often think that I have gone old, and their sex confidence decreases, and that leads to erectile dysfunction. Then come psychological fear. Many times what happens that young boy, he has been masturbating for a long time, he must be having nightfall, low sex confidence due to lack of knowledge. Such boys when go for sex, sometimes fear releases stress chemical adrenaline in penis that leads to erection problem. Sometimes occasional failure happens, like that one day man does not get good hardness. So anytime any cause which leads to erection problem leads to low confidence in man, whether it's due to hormone problem or due to less blood flow, whatever cause. Once man fails, secondary psychological fear acts in mind. Then whenever he go for sex, he has fear in mind that last time I could not get good tightness, will I get good tightness this time or not? This fear of failure leads to release of some chemical from brain, that negative chemical adrenaline, which decreases further penis blood flow. So due to this fear, next time whenever he goes, he touches his wife or girlfriend, enjoy less, fearing that whether he'll get tightness or not. So because of fear, he's enjoying less, so he's getting less tight signal. And he's worried that whether he'll get or not, release stress chemical adrenaline. So next time also he fails. So he fails second time due to psychological reason. First time he may have failed to some disease, but once fail, his low confidence further makes him prone for further failure. So repeated failure decreases self-confidence. And then he remains stressful all the time. This stress in mind stops his early morning tightness at night. So his night tightness stops. Even his testosterone male hormone falls due to stress. So when testosterone hormone falls and night tightness decreases, then you start thinking that my problem has become too big, probably some big problem has occurred, I may not get cured. Then he consults some local doctor. He makes him scared that you've done masturbation, you've done nightfall, your penis has gone, some blood flow problem is there. He makes him scared. And then he gives some medicine. With that medicine, he gets some relief. The moment he stops medicine, again he fails. So when he fails again, then fear comes that probably some big problem has come and I may not get cured. He goes in depression. So remember, almost more than 90% people who are young can be easily cured. When patient comes to me for such problem, I get him first physical examination, then get him all the hormone tests, some detailed erectile dysfunction, sex counseling, penis blood flow test, potency test, and after that whatever diagnosis comes, if hormone comes as a cause, give hormone treatment. Within 4 or 5 months he gets cured. If blood flow is a problem, give medicine to increase blood flow, he gets cured in 4 or 5 months. So whatever the cause, almost more than 99% people can get cured in within 4 to 5 months time. For this, medicine costs hardly 40 to 50 per day which they have to buy from market. Then along with medicine, I provide them with sex therapy exercises. With sex therapy which they have to practice at home, their fear goes off and they are cured even after stopping medicine. Otherwise, normally what happens, patient takes medicine, he gets full tightness, good stretch. The moment he stops medicine, fear comes in his mind. Fear comes in his mind. The moment after stopping medicine, he goes for sex with partner, again fear comes that today I have not taken medicine, whether I will get hardness or not. Then with this fear, it means he is enjoying half, he is worrying. So when enjoying half, tightness signal is going half, so tightness is less. When he is worrying, he is touching the girlfriend or wife, but he is not enjoying full. He is worrying, he is looking at penis, whether it is getting hard or not hard. So enjoying half, worrying releases stress chemical, adrenaline, which decreases blood flow. So the moment stop medicine, again fear comes, again he fails. So remember, if you want to get cured permanently, so along with medicine, you need proper sex therapy exercises to get cured. So meet your doctor, tell him that first get your all tests done, make proper diagnosis of cause, then treat accordingly, and along with medicine, take some sex therapy session so that you get cured permanent. So I hope you understand and you will get cured of your problem easily.